Hi, I'm Dr. Bunkis of Orange County Plastic Surgery in Newport Beach, California, and of Salisbury Plastic Surgery in Worcester, Massachusetts. We used to do many of these seminars at our office, at local hotels, and many patients would come. But we can't do that in this era of COVID, so we decided to try this virtually. Oh, virtual, so I don't have to wear this anymore. Thank you. Our first seminar will be about facial rejuvenation, and that will include anything that we do to make the face look younger, including facelifts, liposuction, injections, and so forth. I'm the luckiest guy in the world. I work with some of the greatest people. These are photographs of my staff in Newport Beach and in Worcester. They keep my schedule straight. They allow things to function, and they're the nicest people in the world. You will see that when you come into the office. Before I get going with facial rejuvenation, I would like to say a few words about who I am and how I got where I am. I'm a board-certified plastic and reconstructive surgeon, and if you look on your computer, Google plastic surgery, you will find many practitioners who are not board-certified plastic and reconstructive surgeons. They may have gotten their boards in ear, nose, and throat, or some aren't board certified at all, and they all do the same kind of work. But if it was up to me, I'd choose somebody who has the top qualifications. In order to become a plastic and reconstructive surgeon, you have to do what we call prerequisite training. In my case, I spent 5 years at Columbia University studying general surgery, and I became board certified in general surgery before moving on to plastic surgery. And I did my plastic surgery training at the Brigham and Children's Hospitals in Boston. When I finished my training, I moved to San Francisco, and I taught at the University of California, San Francisco. And since 1983, I've been teaching on a voluntary basis many different types of students, residents, physicians assistant students. But my primary focus has been aesthetic surgery in a private practice. As you're going through your residency, you do learn how to do eyelids and facelifts and so forth, but the vast bulk of your training is based on reconstructive surgery. We did hand surgery, birth defects, all types of reconstructive procedures, and those kind of patients just don't come into our practices. If you have an aesthetically based practice, those are mainly done at university centers and so forth. And here are a few photographs of cases that I did while I was at the university. The first one is a thumb replantation on a boy who blew his thumb off while making a bomb in Boston. And this type of procedure takes many hours, takes a lot of expertise, and again, it's just not appropriate for somebody in private practice to be doing something like that. I'll show you a couple of photographs of some trips that I've taken to Central America, and I went many times to Guatemala, where I did reconstructive surgery on infants, and I would take a whole team with me. Back in 1985, I took this beautiful lady with me, Dr. Deborah Ekstrom, and as you can see, she's now my partner. We really enjoyed working together. We stayed in touch all these years, and lo and behold, we're now working in the same office. In our practices in Worcester and in Orange County, we just don't see these types of patients walking in, but this is an exception. Manuel owned an art gallery in Mexico, and one of my employees was down there visiting the gallery and saw him. It was kind of obvious that he was having an issue because his nose was missing, and she asked what the issue was. I was very proud of her. She took the initiative to contact the State Department and to arrange for permission for Manuel to travel across the border to come to Orange County. And the anesthesiologist, the surgery center, the pathologist, we all did his surgery pro bono. And you can see I basically resected his nose, and I reconstructed it with a flap from his forehead. He was very happy with this result, especially since he didn't have cancer anymore. But as you can see, the nose is kind of bulbous, and if he lived here in the States, he'd come back 2 or 3 more times to have that flap thinned, but for him that wasn't much of an option. One financial disclosure before I get going with the facial rejuvenation part of the talk. I am a paid consultant for Aesthetic Link, a company that makes radio frequency machines out of Texas, and I will be showing some results that I've achieved with their particular machine. I do not think that my participation in the company has biased in my opinion, but just for full disclosure, I am a paid consultant. First of all, I'll just discuss what happens with normal aging. If you look at a youthful face, it's usually in a V shape with the majority of the fullness up in the cheek rather than down in the neck and the jowls. And as we age, there are some muscles in the cheek and the neck that sag, and whatever skin and fat is on top of it sags with it. So in youth, the face looks like a V, and as you age, it starts looking more and more like an A or like a pear shape, with the fullness being down here and here instead of up here. What we can do to fix this non-surgically is to put a bunch of fillers into the top part of the face, and that pushes this part out a little bit. That gives you more of a V shape, and it's an optical illusion. It makes you look younger, but it doesn't tighten anything down over the jowls or the neck. Here's a photograph of a young girl, her mother in her 50s and her grandmother in her late 70s, and you can see that the girl has a lot of fullness in her cheeks. The mom has fullness in her cheeks because I did a facelift on her the day prior to this photograph, and you can see the grandma who has the fullness at the jaw area and some laxity in her neck, and she doesn't have the fullness over her cheeks. So that's what facial rejuvenation does surgically. There are many options for addressing the neck. In a young person with a fatty neck, with minimal skin laxity or muscle bands, it's possible to treat this completely non-surgically with an injection by a substance called Kybella, which will melt the fat. It's possible to liposuction the fat. It's possible to liposuction the fat and to treat the skin with a radio frequency treatment to help tighten it a little bit. Mini lifts and full traditional facelifts are also options. The best option depends on the deformity and the patient's expectations. The #1 goal of facial rejuvenation is to meet the patient's expectations. First of all, I'll talk about the non-surgical options, and here we're talking about Kybella. Kybella is a FDA-approved non-surgical treatment that contours and improves the appearance of submental fullness due to fatty excess. If your skin is loose, if you have muscle bands hanging there, it is not going to help you. You have to have a fatty excess. And once the substance is injected underneath the skin, it destroys the fat cells, and the neck contour will improve. In most patients, it requires multiple injections. Here's an example of a lady who had 4 different sessions, and she has a fairly nice result. I can tell you that there are some downsides to injecting Kybella. After it's injected, there's a fair amount of discomfort in the injection site. It is hard and lumpy for 6 to 8 weeks. You can't re-inject it until the tissues soften again. So this process can take 4 or 6 months to complete. And by the time you count up how much all the injections cost, sometimes it's cheaper just to go ahead and do a liposuction. And my brain thinks like a surgeon. I just find it so much easier to go in there and spend 20 minutes liposuctioning somebody. They have some bruises for 4 or 5 days, and then they're done. They don't have to do this anymore. But those people who are deathly afraid of having an operation, for them this might be a great option. This next patient is 42 years old. You can see she's got some jowling. She has some laxity in her neck. She had a little excess skin in her upper lid, which she did not like. And I did a upper lid blepharoplasty, and I suctioned her neck. This took less than an hour, and here you can see her 4 months later. I don't think at her age or with her appearance I could have gotten any better result with a facelift. She's an ideal candidate for this procedure. The next lady you see is 35 years old, and you don't have to have eyelid problems to have a neck suction, but it just so happens that she also had excess skin in her upper eyelids, which I took out, and I suctioned her neck. And here you can see from the front, her neck does not look very different, but from the side you can see a very, very definite improvement. Now I can see a little strand of loose muscle underneath her chin in the after picture, but it would have been drastic overkill to open up her neck and to start sewing her muscles together or whatever. She's a great candidate just for a liposuction. And the next patient you see is also in his mid-30s, and he had not only his upper eyelids done, but a nose operation and a chin implant in addition to his neck liposuction. And if you look at him from the front, you'll see that he does not look very different. I can see that his nose is thinner, he has less skin in his upper eyelids. Where you see the big difference is on the side view. And you can see that the little bump in his nose is gone. But his profile just looks far, far superior, not only because of the little bump in his nose, but because his horizontal jawline has been improved because I put a little chin implant in and I suctioned out the fat from his neck. And this makes him look younger, it makes him look more fit, and it's just a very pleasing result for something that was a relatively minimal procedure. Next we'll mention the radiofrequency treatments of the neck. There are two different ways that radiofrequency can be applied to the neck. One is externally, and that is not very effective. The second way is by placing one of these tiny little cannulas that you can see. They're about the size of an IV needle, and it goes in through a little incision underneath the chin, and you just pass that probe back and forth underneath the neck skin until you heat the neck skin up to a point where the collagen will shrink a little bit and you'll tighten up the neck. It does not replace a facelift, but in patients who are relatively young who don't have bad skin laxity, you can get a really nice tightening of that skin and avoid a more major procedure. And the first example is in a lady who was in her early 30s. The second example is a lady who was in her early 40s. And the last lady, you can see that she still has some laxity in her neck afterwards. She's 50 years old. I'd say she would have been a better candidate for a facelift, but she absolutely didn't want the additional surgery. She was happy with what she got just with a thermi treatment of her neck. The last patient in this section that you'll see definitely would have been a better candidate for a facelift. She was 52 years old, but she just did not want to have quote-unquote major surgery. She'd had lung cancer that she survived. She'd had a number of different procedures in her life, and she just wanted something minor to help her neck. And from the front, I can see a pretty dramatic improvement, but if you look at her side picture, she still has a fair amount of laxity in her neck. She had absolutely no qualms about the laxity in her neck. She was pleased with her result, and consequently a good candidate for this procedure. But again, this isn't something that I would try on everybody. The next section will discuss mid-face lifts or thread lifts. And here's the setup that we use for these procedures. We use two long needles that are about 6 or 7 inches long and some threads attached to them. This is an actual picture during an operation. You can see how the threads are inserted. And on the intraoperative photograph, you'll see on his right side, I have tightened the threads, and you can see how it made his cheek stand up. On the left side, I haven't done it yet, you can see how it brought that fullness from the lower part of the face up into the upper part of the face. And it's not a procedure for everybody. If you have a neck laxity or a lot of jowling, you'll get a better result with a full facelift. But here are some examples of some relatively young people who are getting the hollowness in their cheeks and a little bit of mid-face laxity improved with a mid-facelift. The next gal is older, she's in her 60s, and she'd had a prior facelift. Her jawline was still very, very adequate. Her eyes didn't have to be redone, but she was just starting to sag a little bit in the mid-face. And here's a photograph of her a year after I did a mid-facelift. And on the side view, you can see again that it brought the fullness from her jowl area up into her cheeks, and she looks far, far younger with a 20-minute procedure. Not always do you have to lift people to make them look better. Dr. Ekstrom in particular is an expert at injecting fat into people's faces to make them look better, and I do that as well. Here's a lady who was 87 years old. She had 3 prior facelifts. She came in and asked me for another one, and I said, "What bothers you?" Because her jawline was pretty good. She didn't have a lot of jowling, and what bothered her was that hollowness in her cheek. And I fixed her up with some fat injections. I just harvested some fat from her tummy and put it into her mid-face area, and she got a very nice result and saved herself from having to consider another procedure, especially at her age. Now, we've all heard the term mini facelift. I have a lot of patients who come in and ask me for a mini facelift because it sounds less invasive, and it is, but it's not for everybody. If you have a lot of jowling, if you have a lot of neck laxity, a traditional facelift will give you a far, far better result. And in essence, in a mini facelift, we're tightening the skin, but we're not doing as much to tighten the muscles. We're not making an incision underneath the skin, and we're not addressing the muscles underneath the chin. And it's a good procedure for a younger patient with no jowls. And here you can see such a lady in her early to mid 40s who had a little puffiness under her lids, which I took care of, and just a little bit of jowling without any neck laxity. And she has a fairly significant improvement, but I can still see a few bands underneath her chin when we're done. This is a lady who was a little bit older, but also did not have very much laxity in the neck. It was mainly her cheek sagging, and I helped her with the mini facelift, and you can see that she's got a very, very nice result. This last gal had some mid-face laxity, but also some neck laxity, insisted on a mini lift, and if you look at her, she looks a lot better from the front, but on the side I can see too much laxity underneath her chin for my liking. But she was happy. For her, it did what she wanted, and she got her so-called minor procedure. Now, if you have laxity under your chin, you're probably a better candidate for a true facelift. And in a true facelift, what we're doing is making an incision underneath our chin. We lift the skin off the neck muscles, we remove any extra fat that's in there, and we sew the muscles together left to right to really tighten this area underneath the chin. And then through an incision around the ear, we lift the skin up, and we are tightening the neck muscles, lifting them back up to where they were when they were in their youth. We're taking that face that has now started to look a little bit like an A shape and restoring that V shape. Now once that shape has been restored, you have to put the skin back, and this is where results vary in surgeons. I never pull that skin before I trim the excess. I just lay it down and I trim right along the suture line so there's no extra. I don't want to leave extra skin, but I don't want a tight pulled look. Especially in California, if you go to the malls around here or Symphony Hall, you'll see a lot of people who are overdone. And that's a look that I just detest. I don't like it. If somebody wants it, I'll send them to somebody else. Because I have kids in their 30s and all of my children can lift their skin. My kids aren't pulled back tight. Why would I want to do that to anybody? This first lady you'll see was 57 years old. She had some laxity underneath her neck. I raised her brows a little bit, and I also tightened her lower lids a little bit. And that is a very, very youthful kind of a look, but she does not look pulled. She looks very, very natural. And then I'll show you a much younger patient. And if you look at this lady, she has two big bands in her neck and some jowling at a very early age. She's 47 years old. And yes, she's a candidate for a true facelift. She didn't have any issues with her lower eyelids or her upper eyelids, but if you look at the distance between her eyelashes and her upper lids, her eyelashes are touching her eyebrows. So I raised her brow a little bit. I could have raised it way, way higher, but when she was young, her eyebrows were at about the level where I placed them here, and she had about 2 or 3 millimeters space between her lashes and her brows. On the side view, you can see how her neckline has improved, how the fullness has returned to her cheeks from her jowl area and neck, how she has a little space above her eyelashes. And in this photograph, you'll see her at age 23. You'll see that little space above the eyelid. You'll see a big, nice, full cheek. You'll see a V-shaped face, and obviously nothing hanging at her neck at that stage. And the second picture was about 12 years after her facelift, when she turned 60. And you can see that little opening between the lashes and the brow has persisted. She still has those full cheeks. She has a V-shaped face. Nothing is hanging underneath her chin. And she looks very much structurally similar to the gal she was when she was 23. She doesn't look like somebody else, and I think that's very, very important. I've shown a number of female patients. Yes, I do a lot of males as well. This is an example of a 74-year-old male who was still working, told me that he was losing business to younger colleagues, and asked me what his options were, and we discussed doing a facelift and an upper lower lid blepharoplasty. And this is his before and after picture 3 weeks after surgery when he returned to work. And he does not look like a young man, but he looks far more rested. He doesn't look as elderly, and lo and behold, his business improved. And this next lady is a housekeeper in her late 40s, early 50s, who had a rhinoplasty done, as well as a chin implant and a facelift. And you can see that she looks far more youthful and energetic afterwards. Just the whole balance is more pleasing. This next male was 60 years old. He had a number of concerns, and was kind of a difficult case because, as you can see, he doesn't have any hair. And I did a brow lift on him. The brow lift I did on him was with endotines through an eyelid incision. I took a little bump off his nose. I put a little chin implant in him. I did his lower eyelids. And if you look at his after pictures, the incisions were kept very short, just on the ear. He doesn't have any extensions up into his scalp or behind his ear into his scalp. And he can go get a haircut and nobody's going to know that he had it done. And I think that's just a very good example of what we can achieve. The very last lady is one of those who has a little bit of everything. She was older. She was 79 years old in the before picture and 81 in the after picture, and she had a very weathered face. When you do a facelift, you change the contour of the face, but you're not changing the texture of the skin. So if you have a lot of sun damage and weathering, and that obviously happens a lot more in the California practice than in the Massachusetts practice, you have to do something to address that wrinkling, or else you'll have nice contour but look very wrinkled and just look like a tighter prune. And this lady had an upper lower lid blepharoplasty. She had her brow lift, and then I did a CO2 laser procedure on her and put a little fat into her cheeks, and she looks very youthful at 81, much better than she did at 79. And if I would have left any of those procedures out, she wouldn't have had the balanced look that she now has. I want to thank you all for joining us for this virtual event. I would like you to go to our websites to see pictures of additional patients. Both of the addresses are listed here. You can also contact us by phone, or you can send us an email. We will put the email address at the bottom of the slide here, and we welcome your comments and welcome your questions. Thank you for joining us from Newport Beach, California, and from Worcester, Massachusetts.